health disparities, health inequities impact all of us, not just people of color, not just poor people, but all Americans. That it is an American problem that needs an American solution. Because the issue of health and the status of health in this country is the Achilles heel of this country in terms of our survivability. Right now, we spend more on healthcare than any other nation in this world. And we're right at the crucible of the tipping point where we will become a debtor nation if we allow this to continue. And given the political climate, I think we're looking over that edge more quickly than I had imagined 2 or 3 years ago. And it seriously scares me. The other issue is that we're siloed. We still remain siloed in that we have genomicists looking at health disparities, and we have social scientists looking at health disparities, and we have community activists looking at health disparities. And it's almost like everybody's looking at the elephant from a different point, trying to describe what the elephant looks like and what is the solution to the elephant's problem. Those who are looking at the trunk think that the trunk is the most important part because that's where the elephant drinks and it feeds itself, and we need to take care of it. From those who are looking at the rear end, it's how the elephant excretes its waste and where it goes that becomes the most important part in how we look at this issue, as opposed to looking at the entire elephant. And for the last 20 plus years, one of my themes has been the idea of looking at this in a holistic or biopsychosocial manner. And for the last 15 years is trying to get genomicists, social scientists, policy people, everyone in the same room to talk about the issue. And lastly, we need to go back to the infectious disease model in terms of healthcare instead of the chronic disease model. The chronic disease model is you have cancer, you have diabetes, that's your problem. It doesn't impact me, yet it does. That $50 box of Kleenex in the hospital that you pay for, or that your insurance pays for, that you ultimately pay for in terms of your insurance policy, is the result of the chronic disease model. For the infectious disease model, I go back to the maid in the master's house, that he or she was concerned about that maid because that maid took care of their children, took care of the family, and that maid had to be healthy. Today, we don't care about people. It shows up in the current policies with regards to the cuts proposed for Medicaid and Medicare and all of the other social issues that they think just impact poor people, but ultimately will impact them. Until we get to this point where we realize that you don't have to like somebody to care about their health, because ultimately that health impacts you, is that public health disparities and inequities make us all sick.